the period of time where we're listening to comments from the field to a close, I think. But I have to say how impressed we are by people coming out on an evening during the week to spend their time with us and to open up their past experiences, whether they're great, mediocre, or slightly or majorly traumatic. Thank you so much for opening your heart and your minds and sharing them with us, because we feel really privileged to have the opportunity to just listen. And that's what we have done. I hope that you've seen us all pay very close attention to what the stories are that you have been living. And that goes, like I've said, to everything that we'll do going forward as a commission. We work for the Board of Supervisors for LA County, and what we hear today, we keep in mind as we're doing the work with the Board of Supervisors and with the Department of Mental Health to make sure the needs are met and that the needs are noticed and they're understood. And events like this only sharpen our keen awareness of what's going on. So again, our great and deep thanks for being transparent and forthcoming and open with us. It really means a lot. Like I said, this is not the only opportunity you have to engage with us. We are available every month in 2 times. We have an executive committee meeting the 2nd week of the month and a full commission meeting the last week of the month. So please check us out, and also the service area that you're in here, Service Area 7 meets monthly as well. There are lots of other ways to get involved, and so I hope you're able to kind of take a note of some of the vendor booths outside that describe some of the DMH services. We are at your beck and call in terms of a listening ear, so please feel free to catch us when you can. Maybe not at 9:00 p.m., but at meetings where we can listen more and help make change for the better. Destiny?
Okay, I just wanted to remind everyone who came in on the bus that 8:15 we're going to end this session so you can make the bus on time. The bus will leave at 8:30 to go back to Rio Hondo. Thank you.
Great, thank you for that, and that's why we're going to close at 8 so that we can ask Dr. Sherin to make some remarks about the school mental health, all of the children's services, questions and concerns that came up about school clinical psychologists and services, etc., and also touch a little bit on LPS reform.
Well, I have 10 things here, not 2. And you know, with respect to the schools, whether people are aware of it or not, and apparently you're not, which is concerning because you're not feeling it in communities, that this department has put a lot more resources into the schools through LACO and through LAUSD. A lot of that resource is actually intended to help identify kids that are having challenges and get them connected to resources in the community that exist that are actually not being all being used. You know, it's come up a couple times that contractors are being told just to spend their money and not focus on outcomes. The bottom line is that we actually have money in the communities that's not being accessed. So that my point is that we're trying to get money into the school to identify kids who are having issues, but also to get them and their families out into the community to use the resources that are available. We have a long, long way to go. I think our new governor is very aware of the fact that we don't have enough money to, for example, have a psychologist in every school. Yeah, I would love to have a psychologist in every school, although I'll tell you that not every school would like a psychologist, which is an issue. And it's one of the reasons why we have to kind of deal with the needs of communities, the desires of communities on in a tailored way on a one-to-one basis. But I would say to you that the department and the county is committed to enriching resources across the school system. My department threw in another $20 million this year for the schools, and we distributed the money based on a very objective analysis of the needs. So we created an algorithm, and objectively it was analyzed where's the most need, and then we've deployed the resources. So it may be, and that's not every school. I'm not going to pretend like it's every school, and we'll keep driving towards additional resources, whether it's treatment on site, more training, better identification of individuals who are suffering, and connecting them out into the community for those schools that don't want services on site. It's hard for me to know who's in here based on all the questions, and probably I'm going to be responding to questions to people that aren't here anymore, but that's okay. There was a question about our co-response teams, which we have with law enforcement, and we're in the process, and with the board's support, we're trying to get additional co-response teams, clinicians who are stationed and doing work with first responders like the fire department and EMT. So that's a conscious effort. I will tell you that one of the reasons why the co-responders are with law enforcement is because we want to mitigate people getting put in jail. And that's one of the ways you do it. The people that ultimately you will end up taking someone to jail tends to be law enforcement. That's an area of investment. We're expanding those resources. We're also expanding our training to a number of different departments, including our sheriff and our significant law enforcement partners. Thank you. LPS, involuntary treatment. I could talk for the next 5 hours about this. It's a big problem. Our system is not, we have a law that's, I think, 50 years old, an act, and it is actually not, it's not working. There's been a lot of effort around the legislature to throw new bills at a problem that doesn't require a Band-Aid, like a bill that requires a rethinking of why we have involuntary care and how we need to reboot it. And what I'll tell you in short, what I'm arguing and what we're pushing for in this county is, and by the way, we've got an audit around the state right now on LPS law because we don't, the one-off bills are not the solution. We need to take a look at it and fix it. And LA County with the Steinberg Institute and other advocates are in the process of doing that. But really what we need to recognize is that when people are sick, and you have systems like we have, which are not always easy to access and are not always terribly welcoming, and we need to fix those things while we build up our communities, that there are individuals we can't engage. There are individuals that do not want to accept care. Many of them don't want to accept care because they've been traumatized by the system and they've tried to use it. But in those cases, what I would say is that we need to recognize that if we don't figure out ways to engage an individual who's not willing to engage with us despite heroic efforts, as a last-ditch effort, we need to compel treatment. But when we're going to compel treatment and provide someone with a surrogate decision maker, a conservator, we can only do that. We can only take civil liberties when we dedicate resources to recovery. I don't like the term conservator. I prefer a term like a recovery facilitator or a recovery agent. And what we're saying, what I'm saying, and we're saying it to the county, but we're also saying it to the state, is when we're gonna do what we currently call conserve somebody, we're only gonna do it if we have dedicated resources. And that means 24/7, 365, access to a treatment team, housing, and a mental health bed. Because if we have someone that is helping make decisions, they have access to the treatment team, they have access to housing for the individual, and they have access to a mental health bed, then it becomes a recovery proposition with the goal of restoring independence and getting rid of the conservatorship or the recovery facilitator, recovery agent. We have a long way to go, but when we don't do that, we leave people who are sick, who are refusing treatment, to the streets and to the jails. And that is not okay.
And to die.
Promotora program, I'm just going through things as they came up. The Promotora program is a great program. It's another area where we're trying to expand. We're trying to expand across cultures, across languages. I wish that we had an extra $1 billion to throw at all of the things that you all want, trust me, more than anybody. And we're actually fighting for that. We're fighting for it by trying to get the state to throw more skin in the game with the counties and also to facilitate the way that we access federal funds. And I'll tell you that when we access federal funds by jumping through hoops and checking boxes and taking care of the medical chart and the auditors, we lose capacity. That's a big deal. What I'm saying is that probably, I don't know, maybe half of every dollar is spent on administrative red tape. And I've spent my career working on cutting red tape, and it's gotten me into a lot of trouble. And I did it in the federal government and the VA, and I'm now trying to do it in the county and in the state. The Board of Supervisors made a pretty significant decision when they decided to not build a 4,000-bed jail, but to reconsider investing in care as opposed to custody. And now we're in a situation where we need to think about what do we do to enhance care and expand, as I have said, the hospital beds, the open residential beds, the intensive treatment teams, and our immediate response in order to get people, when they fall out of community, back into care as opposed to into custody. And I'm just making a broad statement about that because a number of people talked about what we're doing about keeping people out of jail when we get them out, and then when they come out. And the answer is investing in care. SB 10. I've been working on peer activities for the better part of my career. My top priority when I took this job was peer support and getting funding for the peer movement. And we have driven that in this county, and we've driven it with great partners in the state. And I'm bewildered by the fact that we have our current new administration and that this bill got vetoed. And you can rest assured that that disappointment has been relayed. So when I found out, I immediately contacted the wonderful senator, Senator Jim Bell, who wrote the bill and has written the bill before. And I said, yo, Jim Bell, we need to write a new bill. And he said, yes, we do, and we're going to. The board is going to have this as a priority, I would assume, because I'm certainly arguing for it, and they have supported it in the past. Steinberg Institute, again, very much on board with us to get funding for the peer movement and to build out a peer division in this county like no one's ever seen. And there's so many reasons for it. Again, I don't, just like LPS, I can go on forever. CES, the coordinated entry system. The coordinated entry system is, I think, a great idea. It's a really important thing, and I think it's helpful, going back to the prior comments about the complex homeless population. I don't think it's really serving those who are really sick very well. And what we're trying to do is develop pilot programs where we, the Department of Mental Health, do not need to use the coordinated entry system for people that we need to get into housing. So I'm saying this in public, and because it's something that we really feel that we need to do. We need to empower our people who are doing outreach, who are working in our clinics, to have direct access to beds. We've got our own lines. We don't need the line to be around the block, especially. And look, we all care about every homeless person. But again, my department, the mission that we have is to look after those who are the sickest and who are the most vulnerable. And we need to we need to get around what has ended up being, I think, a process, and a process that sometimes is interfering with our ability, matching a resource with a need. Client satisfaction as a driver, we do satisfaction surveys. We do them for our clients, and we also do them for our staff, and in particular for our frontline staff. Because working in this bureaucracy is not easy. It's really tough. And perhaps we don't do it enough, or perhaps we don't do it properly, and I would challenge you to say to me and ask, what is the best way for us to assay the satisfaction of our clientele around the county? Maybe you want to do a pilot in this service area. I don't know. I'm all ears, and I'd love to know how we can better understand where we're meeting needs, where we're performing in a way that means something to the community. And what are the major deficits, what are the areas that are problematic and that are impacting the satisfaction of our clients, families, neighborhoods, communities. Parking at Rio Hondo and AICC. Well, this is a place that I've been. And I have come close to getting hit by a car crossing the street from that parking lot that we've talked about. So this, and And I mean, I always park over there because I figure, why I'm not going to take up a spot. And I'm pretty quick. I used to be faster. But this is an issue, and I've had eye contact with Manny about this issue because it is one, and we need to look into how we can get access to additional parking. This is an ongoing problem, and frankly, we're looking at how we can find a new facilities, because we need them. And you know, it does get to an issue which has come up from a number of different people around the entrance, and you know, facing you know, gun-bearing guards as opposed to loving and welcoming peers at our front door. We have a long way to go. I can't wave a magic wand and say, no directly operated clinic will have a security guard. There will be no plexiglass. If I could, I would. And there's a lot of reasons for that, but we're moving in that direction. You know, I'm sitting up here and in the audience, there's so many families, and this is the hardest part. But, you know, NAMI as an organization, and many, many other organizations that recognize the pain and the challenge of someone in the family is a big deal. And what I say to my staff and what I'm trying to do in developing our programs is to say, you don't take care of individual people, you take care of family, household, nest. That's the unit. And it's not just us. You know, it's this field, and it's also California. We don't recognize the power of family and the power of reunification. And part of the reason is things like federal law and HIPAA. And I'll tell you that I don't think we have the most progressive interpretation of HIPAA in our culture. And I want to work on that. And we need to... And we're trying to be intentional about it. We are definitely trying to expand our partnership with NAMI. And it's not just about NAMI. NAMI's an incredible organization. But we need to figure out ways to leverage our humanity, our family, and drive towards connectedness. And Supervisor Solis said it, and I believe it. It's about connected communities. You know, whether it's 2 people, whether it's 100 people, whether it's thousands of people, we have to be connected. We have to care about each other. We have to accept and embrace each other. And we don't do that. And people who are suffering are considered other. They're excluded. They're left on the streets. And people in the NIMBY arena will say, get them away from me. They're interfering with my daily life. Well, guess what? They are us. We're a community. And until we recognize that and figure out how to operationalize it across all socioeconomic statuses and all different cultures, we will continue to suffer in terms of our county's well-being. There's a million other things to say. I probably ran out of time. I do that. I'm 2 minutes over. That's not bad. I send you all love. I'll be back the next time, and I'm coming to these commission meetings. And also, I want to really, really applaud the commission for doing this. I want to applaud you for the town hall concept. I want to applaud you for coming out in the evening, for getting an incredible venue like this, and to this principal. I don't think you're still here, but God bless you. And I'll also let you know, for those of you who are kind of following the Your DMH movement, we're looking to create, you know, in general, although I don't think we're going to be able to do it this month, we're going to be having the commission meeting along with our overall stakeholder engagement effort, which is going to be like a full-day summit on a quarterly basis. Those of you who are familiar with the annual updates, which were once a year, I have been asking myself, why are we not doing this quarterly? And why am I, John Sherin, not spending my whole day with my community 4 times a year to absorb all of the love and anger and disappointment? Because I am here, and that's what I'm doing, and that's what I am committed to continue doing. Thank you.
Thank you, Dr. Sherin. A reminder that the next Service Area 7 Town Hall will be on Saturday, January 25th, so something to look forward to.
No, this
and in
is-
the spirit, I'm sorry, Service Area 5. And in the spirit of weaving a stronger community together all the time through events like this and all the other times we spend time together, I'd like to recognize the people who brought this night to a great effect, and that is the DMH staff from this service area, starting with Manny all the way down. The service area co-chair folks like Ashley and Jaime and Rick, the Department of Mental Health, and the commission staff from the DMH, including Pinky, all the way down. Thank you so much to everybody who coordinated and provided for us this very day, and thank you very much to the commission for showing up to be here to listen as well. And with that, we will adjourn.
Thank you very much, Ms. Commissioner, Madam Chair, and to our mucho gratitude to Dr. Sherin, DMH. Our advocacy is it's just inspiring to hear him speak. I love it. And to all of you that came out and your families and all of our colleagues on behalf of SAC 7, we say God bless you. Gracias por estar aquí, que estamos adelante. Siempre estamos para ustedes, los familias primero. Thank you to our commissioners. Thank you, Brittney, our chair, and all the commissioners for everything you do for our families. God bless you and have a good night. We'll see you at the SAC meeting. Bye. Good night.